morning. This is Kerri Barber reporting with Real Progressives. This morning I've got an rare opportunity to catch up with Dr. Peck. She is a volunteer advocate for Medicare for All, working with Our Revolution Local in Chicago, as well as Physicians for a National Healthcare Plan. Good morning, Dr. Peck. Thank you for your time. Just a couple questions for you. How did you get started with Medicare for All?
I got started with Medicare for All because as a physician, I've been in practice for over 25 years in internal medicine. And every day I see patients who can't afford their health care. I see people who have to switch doctors because their doctor they've been seeing for 20 plus years is no longer in their network. I see people who stop taking their insulin and then develop complications of diabetes. I see people who won't vaccinate their kids because they can't afford it. And when I saw Representative Jay Powell's bill come out, I read it. I think it is fabulous, and I think Medicare for All is what we need in this country. Healthcare is a right. Everyone deserves healthcare.
Okay, so you have been an advocate for quite some time and working with various groups to get some of our elected congressmen and women to sign on to support for the bill. Can you tell us about that work?
Sure. I am a co-organizer of Our Revolution Lake County. I'm also a member of Physicians for a National Health Program, as well as the Illinois Single Payers Coalition. I actually got involved more with the advocacy part of it, the political advocacy, when a representative from National Nurses United reached out to me, and I read their email and I said, you know, it's time that we go and talk to our congressmen. It's time that we get the legislators involved and get them signed on to this bill. And so back in January, I put together a statement that talked about why I believe in Medicare for All and some of the talking points that I just told you. And I sent it to my congressman, Brad Schneider, Illinois District 10. I received a message back from his staff member saying that they would check his schedule and they would set up a meeting with us. And I requested for 5 members of Our Revolution to meet. And the congressman, I'm sure, is very busy, and we finally had a meeting with him on April 17th. There were 5 of us at the meeting, and we presented our case to him. We presented how we would pay for it. We presented what benefits it would have. One of the Our Revolution members put together a statement about the finances of people in his district and who would benefit, which is 95% of people would benefit. And he said, I believe healthcare is a right, but I don't understand how we're going to pay for this. And I don't think, and I can't sign on to it right now, but healthcare is a right and my door is open to you.
So has he followed up, or have your groups followed up on that?
Well, yes, we have. We did a town hall on May 6th. That was a presentation, well, as you know, you were there, but we did a presentation for the community. We didn't have a great turnout, but I think it was a good start, and we're going to do that again. I sent an email to the congressman after the event, after we met with him April 17th, and I asked for a response, and I finally did get a response actually yesterday. The email was written as, I still can't sign on because I don't understand how it's going to be paid for, even though we did indicate to him how it would work with a small increase in taxes, and people would actually be paying less than what they're paying now. They would save on co-pays, deductibles, out of pocket. But he recited a report by the RAND Corporation that said that it would cost more money, and I'll be honest, I haven't read that report yet myself, but the Mercatus report and other reports have indicated that we would actually save money, and to the tune of $500 billion a year. So we do plan to go back to the congressman again. We did have a Medicare for All Day of Action yesterday at his office with Our Revolution, with the Our Revolution Medicare for All ambulance that is traveling around the country, which I'm really excited about. It started out in Maryland and New Jersey, and now it's here in Chicago from Thursday until Sunday. And we're doing a presentation today for the AMA protest today for the AMA, and I do plan to do another town hall, and we're going to do a canvas in our community and see how many signatures we can get and bring it back to our congressman, and hopefully he will follow through. Hopefully he really believes healthcare is a right, and I hope that he can see that Medicare for all is really the way to go. We can't have any more Band-Aids on our healthcare system. We need real reform. We need Medicare for all.
Okay, well, I really appreciate your time this morning. This has been very informative, and good luck with your congressman, Mr. Brad Schneider. And